This is Krista. Welcome back to week 3 of 3 of our ILADS wrap-up from 2025. Stay tuned. MadeToBeWhole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on MadeToBeWhole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing. Welcome back. So the last 2 weeks, we covered healing the terrain and then diagnostics and pathogenesis. This week, we're going to talk about treatments, which I know is what everybody loves and everybody wants to know. There's a new magic treatment. But I had this book idea. So imagine this. One day, you're going to go to the store and there's going to be a book and it says, Shortcuts to Healing by Krista Michener. And then you open it up and it's blank. Because there are no shortcuts to healing, guys. There's no fast and easy cure. The cure is, first of all, if you're lucky enough to know you got a tick bite and you see it right away, to get freaking early treatment, because that's the very best thing. But if this is chronic, you've got to do all these other things. You've got to do what we've talked about the last 2 weeks. You've got to help not just the infection, but the infectious sequelae, meaning what happens as a result of that infection and what else is going on with your immune system and what other vulnerabilities did it expose. And you can write your own victory. It doesn't mean you will be pain-free, symptom-free, everything will great, that'll go fast, but you can get better. And I was thinking about my own journey. So my first ILADS conference was 2021. It was at that conference that I started realizing something's going on with my kids. And then in the ensuing year, found out, my kids have Barton Babesia, and so do I. And they probably got it from me. And I think I've had it from 20 years. And you know how we just go in circles and we feel like I'm doing the same thing again and again and nothing gets better. So I'll go through this with patients. What's different than last time? Nothing. It's all the same. And then I go through their list of symptoms that we had talked about last time, and some of them are gone. You know, it's easy when you feel bad to forget the little victories. And I've mentioned before, Dale Renlund gave an analogy. He was talking about sometimes we feel like we're going in circles and we're looking down at ourselves saying, I'm doing the same thing again and again. But if we step back, we realize every time we go around the circle, we're ascending. We're getting a little higher, like we're climbing a mountain. So I decided to use the marker of my yearly ILADS conference as an indication of progress, because sometimes I still have some really hard days and I get discouraged. But year 1, before I knew I had all of this, I was there with massive anxiety and panic attacks. It was very, very difficult. And I used to have those a lot, especially in new situations. Everything I've found in this journey has helped that tremendously. Plus, it wasn't new. So year 2, I had started treatment. And the thing I remember physically is massive insomnia. It was so bad. Like, I was lucky to sleep 2 hours. I was pounding my trazodone and my melatonin and my CBD. I don't remember what else. I was taking everything I had. It was doing nothing. Horrible, horrible anxiety. Year 3, I go to the conference. So this is 2023. And I was having a horrific die-off from Babesia treatment. I remember not being able to make it through the whole day because I was too weak and it was too hard to hold my body up and my head up. And I would have to go in the middle of the day and lay down. So 2024, which was last year, the main things I remember, I'm pretty sure I had a UTI. I was peeing a lot. That was not very fun. But on top of that, it was just still the cognitive piece, really difficult time concentrating, processing the information. You're there, you're glad for who you're meeting, what you're learning, but it was still just kind of this inner stress and trouble processing. And I realized this year, those things were better. Now, I will say I'm quite the little traveler because routine really matters. And I've mentioned before about how I do my sauna every day and I do my foot bath and I have all of these things that I help myself. So I'm going away for 4 or 5 days. I have a massive suitcase that's incredibly heavy because I carry in that a portable blanket sauna so that I can do that every morning, a portable foot bath. I have my heating pad because I lay on that. I have all of my supplements and stuff. And it's it's a catch-22 because part of you is like, man, I would love to be the person who just like throws this carry-on together and can go. But at the same time, at least I've found things that make a difference and keep me going. And I did really well. Like, it's the best I've felt at this conference. And even though I could still go through the symptoms I have or the things that were hard, it was very encouraging for me to take that long view and say, okay, 2021 to 2025, there are some things that are measurably different. And on top of that, you have the measurably different factor of knowing what's, and so at least there's an explanation for what you feel. I'm going to go through some of the treatments that were discussed, not just for vector-borne infections, but for all of these associated conditions too, like viruses, mold, other things. And that will include medical treatments and some kind of alternative things. Now, as far as treating sleep, so we did talk about that being really important for healing the terrain. One thing that Dr. Bransfield said that I think is a good little tidbit. So trazodone, which we frequently use for sleep because it helps delta sleep, it helps with you falling and staying asleep, is an old antidepressant that is used at doses of between 25 and 300 milligrams for sleep. It depends on how sensitive you are and how messed up you are sleep-wise. Now, a lot of times people start trazodone and the first little while they feel almost hungover, but he reiterated what I have told my patients: hang on for a few days because it could be that you're finally catching up on that sleep deficit. You feel hungover because your body's like, thank goodness, I can finally sleep, and it just does not want to wake up. So I wouldn't throw in the towel right away, but if that kind of hangover feeling persists, you can manage that by splitting the dose. So say you're taking 100 milligrams of trazodone because that's what gets you through the night. You could take a half of that right before bedtime and a half of it 2 hours before bedtime, like enough that it kind of gets things started and primes the pump, and then the other portion of your dose right when you go to bed. So I like practical advice. I thought that was really, really helpful. A treatment for the lymph issue that we talked about. So Julia Hellstrom, she is an osteopath. She talked about lymphatic function and osteopathic cranial concepts in the management of complex chronic illness. That's a bit of a mouthful. But an osteopath is a DO, a doctor of osteopathic medicine. You've got MDs and DOs. Osteopaths are trained in spinal manipulation, those sorts of things. Not all of them actively participate, but finding an osteopath that's trained in the manipulation of the cranial sacrum can be really, really helpful because fluctuating the motion of the cerebral spinal fluid gets those membranes going and helps that lymph get moving. Now, there's actually a website that you can look at that gives you a lot more information on that. It's www.cranialacademy.com. So I would recommend checking that out. I thought that was super fascinating. She mentioned too that you've got to get your lymph to move for your glymph to drain. So remember, glymph is the lymphatic system of the brain. Lymph is everything below that's more embedded in these soft tissues. And that makes sense if you think about it like physics. Like if there's a traffic jam, if all this is blocked up in the lymphatic system, there's nowhere for the glymph to go because it all joins up. So you've got to do lymphatic work for the glymph to move. If you look up, there are a lot of different interventions. Some of them are DIY. So if you go online and you say, hey, yoga for lymph drainage, that's one thing. There are massage therapists that do lymph massage. That's why we recommend things like the detox foot bath and the vibration plate. They can help. I also invested in the Flowspresso system, which we're going to do an episode on, but it is a suit you can put on that manually pumps and helps lymph drainage through the bottom. And it's a little different than the ones that just do the legs because that pumps and gets things moved up, but where does it go from there? You don't want that all settling in the abdominal cavity. So it works on the stomach and the arms too. And then for the craniosacral piece, a couple of different DIY things that you can do you can do dry brushing. You can look at massage interventions you can do yourself. But you can also look if there's not an osteopath near you, or if you have this preference, just Google craniosacral therapy near me. After we did our episode with Carol and she talked about her experience as a craniosacral therapist, I found one near me and it was phenomenal. I'm going back tomorrow morning at 7:30. I had the best week I had had after that. My head did not feel as heavy. I didn't have to lay down early after dinner like I sometimes do. It was really, really good. But she spent an hour just working on my head and neck. And the next week I had her just do a little bit of that and do the rest of my body. And it didn't go as well. So I realized, okay, this is a big issue. And this is something that I've got the power to control a little bit. So think of your treatment not just in terms of killing the pathogen. It's not just kill, but then how can we help our body take out the trash, so to speak. Geraldine Brosfield is a MD who specializes in TMS, which you may have heard about, like for its effects on depression, anxiety, that sort of thing. But it has the ability to increase the density of your dendrites as part of your nervous system, to increase glutathione and dopamine activity in the brain, to increase glutamate and GABA, and to increase the strength of the synapses, which are how your nerves communicate with each other. We talked before in our last episodes about the issue with having fungal infections in the nose and how to treat that. And it can be other places too. I will say there are oral medications that we can sometimes successfully use for that. So sometimes fluconazole. There is a doctor there that even uses quite a bit of terbinafine, which is typically reserved more for if you have like the toenail fungus issues. You've got to monitor liver enzymes, but he had really outstanding benefits with that. The other thing we can do, though, is to have some nasal sprays compounded. Nystatin is a very gentle way to start, but you can also have BEG spray or BE spray compounded. The other thing I like about having specific results, so when we talked about using microgen or microbiology DX to determine which pathogen is there, we can make sure we're giving you the right medication. So we can have the nasal spray made for you, for your body. Now, this is about inflammation and immune function, and you're going to like this because it's pretty trendy right now, but Dr. Dempsey talked about enhancing immune function with GLP-1 inhibitors, and that would be your semaglutides, like your Ozempic. Very, very trendy right now. I don't have anything against them, but I'm not a weight loss practitioner. Care that much. It's just not what I want to get into. People ask me about it, and I'll do it. If a patient asks, I'll do it. Feel like I kind of have bigger fish to fry. And that for a lot of people, the weight is more the symptom of their underlying health problem. But what she talked about was really, really interesting. She was using microdosing because we know that mast cells interact with our adaptive immune system. What MCAS is, mast cell activation syndrome, it's the excessive release of mast cells, which leads to other downstream dysregulation of the immune system. It correlates with metabolic syndrome, which is that high insulin, overweight, some of those sorts of things. And there's actually some evidence that there might be mast cells in adipose tissue, which is your fat. So metformin can actually play a role in stabilizing mast cells. For some people, that might be a good intervention, depending on what else they have going on. But mast cells also have GLP-1 receptors on the surface, and they also have GIP receptors. That's why you have semaglutides, but then you also have medications like tirzepatide. Many mast cells are in the bones, so that's why there's actually people with MCAS have more osteoporosis or bone loss. But she's having a great deal of success with microdosing these medications and starting as low as 0.025 milligrams for the semaglutides. But she's had patients who, with their first dose, feel improvements in brain fog and other inflammatory symptoms. And one of the things she brought up, it's certainly fair that people will say, well, that's probably because of the benefit of the weight loss, but these people were feeling the benefits prior to weight loss. And a lot of them had minimal or moderate weight loss, not even anything massive. Now, I will say, along with that, there's a lot of perhaps overregulation of these medications. These are peptides that have been around for a while, but they're a big moneymaker for someone. And it's certainly, we want to keep the manufacturing of these substances out of the hands of people who don't do good quality control and aren't scientists. But for the most part, to be able to do this microdosing, you're going to be paying out of pocket, and you are going to be doing it through a compounding pharmacy. We have a few compounding pharmacies we work with. There are oral semaglutides or versions of other similar medications. Some of them are tablets, some of them are sublingual. There are still injectable forms. It would be a weekly injection. You give it to yourself subcutaneously, which for most people, you just squeeze the fat in your tummy. Most of us have some of that. You shoot it in. You can do it your arm, your leg, wherever. But that I'm pretty interested in. I also am wondering if it could have benefits for people with GI upset. You know, one of the concerns about these medications is their effect on gut function, but I'm thinking, you know, we have some people with like really rapid transit issues, diarrhea. If this slowed them down a little, for them, it might be beneficial, and if it's reducing inflammation in the gut. We also had a fair amount of information on Epstein-Barr virus reactivation. Now, I really appreciated the perspective that was shared. It's one of those kind of like trendy topics that people know a little bit about, and they'll say, oh, I have Epstein-Barr, my Epstein-Barr was reactivated. You can't get rid of it. I believe Epstein-Barr is opportunistic, okay? So I have a niece who got really, really sick over the summer, like severe pain, fatigue, all of those things, went to their pediatrician, and they wouldn't test for Lyme unless the Epstein-Barr was negative, and the Epstein-Barr was positive. But thankfully for this niece, she has a really smart mom who's like, you know, this doesn't add up, because she has a large family. I have other kids who have had Epstein-Barr, and they were tired, but they didn't have pain. They didn't have fevers. They didn't have sweating. So we did Lyme testing, and there was Lyme. And guess what? She started an antibiotic, and her symptoms got better. So Epstein-Barr, and the other thing I'll back up with that is, if that were an issue, why was nobody else in the house sick? You know what I mean? Like, you've got all these kids living in close proximity. Why weren't they all tired and having the same symptoms? So with Epstein-Barr reactivation, people who have had a virus and then it gets reactivated, when you do testing for Epstein-Barr, you can look for antibodies, which we've talked about before. A lot of people have IgG antibodies because if you've been to high school, you were probably exposed to Epstein-Barr. It's not necessarily alarming if you have positive IgG antibodies. It depends on the level and if you have a baseline to compare. But you've got IgM antibodies, and there is PCR testing. There are other ways to look. The reason it matters is because there's actually something that you can do about it. We also know, I'll step back, that Borrelia burgdorferi, which is the bacteria that causes Lyme disease, can cause rapid reactivation of Epstein-Barr. So that's why you're looking for the antigens and the IgM antibodies if it's been reactivated. So valcyclovir is an oral antiviral. You may have heard of it mostly in terms of things like herpes simplex virus, HSV1 or 2. HSV1 is more the cold sores. HSV2 is genital herpes. But Epstein-Barr virus is a human herpes virus. So it's HHV4. We just usually call it Epstein-Barr virus instead of HHV4. So valcyclovir can be effective for that. You can do it a couple of different ways. It can be taken up to 3 times a day. If someone's really sick, it makes sense to start low, like at 500 milligrams, maybe even 500 milligrams once a day, and work up. I am really happy when I get data from people about how long they're treating. And the presenters found that they needed to treat for at least 6 months to get the full benefits of this. And the other thing that they did, which I thought was really helpful, is they titrated up to a fuller dose, but then they titrated back down. Instead of just saying, all right, you've done your 6 months, we'll stop, then they backed off slowly, because you really, really want to make sure that when you back off, the patient doesn't crash, and they're going to do okay. Dr. Moorcroft spoke about babesiosis. An interesting point is he talked about how Borrelia burgdorferi, which is Lyme disease, attenuates parasitic growth, and Babesia microti exacerbates Lyme-like symptoms. So this overlap, you certainly, 1 + 1 isn't always 2 as far as symptom severity and impact on your immune system and inflammation. Sometimes 1 + 1 = 10. It's more synergetic. But he did recommend, and I second this, I like using scientific terms. I don't like using Lyme. I certainly don't ever want to hear any of you say limes, because there's not an S at the end of it. I don't think you're dumb, but I don't want other people to say, hey, those guys don't even know what they're talking about. So it's Lyme, or borreliosis, or Borrelia burgdorferi if it's actually Lyme. In the case of PANS and PANDAS, he recommended using the phrase infection-induced autoimmune encephalitis, because that's what it is. When we use some of our trendy colloquial terms, I think it takes away the kind of the scientific authenticity. And since we're already in an uphill battle about public opinion and accepting the effects of chronic infection, we want to do everything we can to help our case, and for people to say, hey, these guys are good scientists. They know what they're talking about. I also did find, another side note, I got the results while I was there. We talked about the Cunningham panel. Formerly, it's the autoimmune brain panel. So Gideon, who was on the podcast fairly recently, who's made some progress, but it's still been a real struggle, especially with fatigue, mental health, and then weakness, leg pain and weakness. I decided I've just got to see what's going on, because he's not getting any younger. And his autoimmune brain panel was positive for a couple of different antibodies, which means he does have autoimmune encephalitis, but it's actually a tremendous relief, because there's an explanation and there's something to do about it. And I felt really blessed, because the person from that company was there for me to chat with. They were a vendor, and then I was able to talk to some people who do IVIG, which is the treatment. And hopefully, as we become more versed in that, we can be a better resource for you and for our patients. So, Dr. Nathan and treatment for mold. I'm not going to go into all of these protocols. You can read his new book, you can go online, but I wanted to talk about a couple of principles that I think are good. He talked about starting with the binder for the mycotoxin that's in the greatest excess. So if you've done one of these real-time lab tests, you'll see I think it's 5 categories of mycotoxins. And you might have some that are a little elevated, some that are normal, some that are borderline, but some that are really, really high. So instead of trying to do everything, he's like, start with the one that has the highest levels. Once that's calmed down and you're tolerating that treatment, move on to the other ones. He recommended going on a high protein, low carb diet. In his experience, he doesn't feel like food itself, food sources of mold, are nearly as big of an issue, with the exception of coffee. Sorry, guys. Coffee can be an issue, so mold-free coffee is the better way to go. But carbs feed the mold. And so he recommends doing 20 to 60 grams of carbs a day. There are a lot of different ways to do that, but kind of like an autoimmune paleo type diet minus the fruit would be good. As far as the use of antifungals, those are important, and that would include things like itraconazole, because that can help remove the mold where it's colonized, and that's the sinuses, the gut, these wet, moist places. But you should start the binders first, was his recommendation, because when you take the antifungals, that gets the mold moving, and you want something to be able to basically move it out. In his experience, it takes a year or longer to clear. So that's a big deal, but that's why clearing the terrain first, I think, is important. If you find out you have significant mycotoxin illness, put in the time to get that taken care of, because you're going to do much, much better in treatment for vector-borne infections if they're present. He recommends rechecking the urine test every 3 to 4 months. And then once you get a negative urine, treating for an additional 3 months. So it's so tempting to say, oh, I'm negative, and you want to celebrate and quit. But I do see this principle be true for a lot of health conditions. Once you get that negative and your symptoms are good, you want to extend treatment for a little longer so that you don't just get good, you stay good. He does have a new edition out of his book, Toxic. So I would refer people to that, because he gives a lot of detailed information. And I think it's exciting that we have, we have so many people who are very generous with their knowledge. If you think it's an easy path to be a trailblazer for some of these issues like mycotoxins or Lyme disease, it's not. I mean, sure, there is some notoriety, but it's not all positive. And you have people who have given their lives to furthering these causes who deal with a lot of persecution as well. So shout out to everyone who is out there sharing their knowledge and trying to help make the world better for providers and for patients. I'm gonna hold there. We did have some more things about IV antibiotics, IV nutrients, peptides, but really I think it's kind of dangerous for me to talk protocols, because everybody's so different. You have different sensitivities, you have different resources, you have your different places in treatment, and not everybody's going to respond to the same thing. And it's too much, for me to say, oh, you have to be on X, you have to be on X. It's so different. I think as a matter of principle, I will end with one of the things that Dr. Bransfield said. He thought it was really important to start with what hasn't been done before. When you're assessing things, individualized treatment and do what hasn't been done. If you've been on extensive antibiotics and you didn't improve, that's probably not what you need. Is it possible that there's another protocol out there that would help you? Sure, it's possible, and we'll look at what's been done and what you're actually testing positive for, because we want good validated labs to drive what we're doing. But it's also possible, if you've done that to the nth degree, that there's something else driving this. The same goes for mold. If you've treated and treated and treated mold and you don't feel any better, maybe mold's not the main issue. It's possible that there's more you need to do for treatment. If you haven't had your home looked at, sure. But it can be very tempting to frame ourselves as one thing, and people will say, oh, I'm a Lyme, or I have XYZ. But you're a person, and your body's complex, your health is complex. You've got genetics and environment and so many different things interacting. Don't be afraid to zoom out and say, hey, what have I missed? Surround yourself with a team of people. It doesn't need to be a big team, but look for people who are kind and supportive, and remember to have hope, because you are made to be whole. Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.